Hi guys, welcome to yet another episode of Knowing Your Medical Maestros. We are your hosts, Toti and Zippy. We are excited to introduce our guests for the second segment, and let's dive into what we call misconceptions in medicine. Karibuni. Dr. Karuri,
Yes.
karibu to misconception.
We?
Ni jina kubwa.
No, ni vile it is
Ziko
packed like
mingi.
this. Yeah.
Wacha sasa tuanze. Tumetoka medicine, umepitia Kapenguria, Pokot. Now you've gone into, now umesha practice sana. So what would be like the thing that iliku surprise the most
The
in
biggest challenge.
West Pokot?
Oh, West Pokot. I think, first of all, viewers, let me say this. Kenya is ours. And every Kenyan has a right to access quality healthcare. That's Constitution 2010.
Yes.
Yeah.
So, like every other medical or surgeon or consultant, we did not want to go to West Pokot.
Yes.
And it's because it was perceived as a very dry place,
Yeah.
very hardship. In fact,
Yes.
it
Hardship
was a
area.
disciplinary center for a long time.
Yeah.
And I will not lie to you. I was there for 7 years. And it's not because I did not have an option. I grew to
You
like
grew
the
to
place.
yeah.
And the reason is because of what we thought, what had been painted for it to be.
Yeah.
Unaona hizo nyumba za
As
the
a hut.
founding father,
Yes.
Jomo Kenyatta and his
Manyatta.
5 friends, Kapunguria 6, you know,
Yes,
Kapunguria
the
6.
Kapunguria 6.
So when I was going there, my misconception was it would be a hard place.
Yeah.
But in reality, it turned out to be the bed of a foundation that I required later in life. So my first misconception is don't say no and turn away.
And,
Just go see. And this is to my younger medical officers.
Yeah.
Go and see. Don't think that medicine is only practiced in Nairobi. Go and see county hospitals, faith-based organizations,
Yes.
and you'll be surprised how much impact you can do with a little effort.
A little
Yes.
effort, yeah.
Yes.
I think hapo ndo inakuanga ni challenge for most like medic. Unajua unatoka ni 60 unasema unajua nini? Nikienda Nairobi,
Yeah, you have
hapa
this
ni
plan.
kuna experience unaenda kupata in Nairobi.
Yeah.
But you now moving to West Pokot, like ulipata ni just a kawaida hospital. Let's say it's just a Gaba hospital,
Yes.
in all honesty.
Yes.
So the first thing that you went and decided, okay, now I'm here, I'm not leaving. Or maybe when you finally told yourself,
Yes.
ninakaa hapa. So what other challenges might you have experienced while you're trying to even make it work? Because it's not as easy as being in a government hospital and you've also left this idea of, I want to go to Nairobi and have my career in Nairobi.
Good one again. I think another misconception is a government hospital can't work.
Oh, yeah.
Because
We have that
the
one a
reality
lot.
is you can actually make it work. And there's lots of examples. But since I was in West Pokot, I'll use that one.
Yes.
I also mentioned More Ranjas.
Yes.
The first challenge that I had was when I went to West Pokot, the governor then wanted me to be the medical superintendent immediately. And I refused because you have to understand the culture that
And
people
how
have
systems.
and how systems are before you purport
To be a mkubwa,
yes, or to try and fix them.
yeah.
So I did manage to reorganize the culture of that place, and Another thing is Kenyans work hard. Kenyans are hard workers.
Yeah.
And if you give them the right environment and the right
They will
tools
thrive.
and the right encouragement and acknowledge good when it's done. See, kila wakati ni kiboko.
Kiboko, yeah.
So I'll give you a very good example. When I was in West Pokot, I found, when I became MedSoup, I found a situation where the HMT, the Hospital Management Team,
yes,
had 33 members. 33.
Those are many.
Those are so many. You can't make a single decision because everybody is there for their own interest. Again, people prosecute their own interest.
It's true.
So as a leader, if you want to understand that, allow them to do so,
So that you
provided it does not involve corruption, it does not involve deterioration of the fabric of the hospital. Whatever. So imagine I got support from the governor, His Excellency Lonyangapo, and I asked him, if we want us to move, we need to reorganize this.
System. Yeah.
And we moved from 33 members to 14 departments.
Nice.
Each headed by a consultant in their own right. If it's a nurse, if it's a like that. Okay. Now, it's great to give people work or offices, but you also must support
they have to,
As an executive, what I did, each department had a budget. Imagine, when the money comes,
unagawa.
allocated.
first of all, we are the ones who set up the Facility Improvement Fund, FIF Act 2019.
Yeah.
And it was the one that was became national.
Yes.
So we used to collect money and we retained 70%. When those 14 departments, kama yako ni 100k,
Unapewa.
nakupatia kama head of department, AIE, authority to incur expenditure. I am the one who's responsible for it, but you as a department can use
How you do
for what you want.
budget,
Provided, number one, mwezi kula more than 30% per sitting allowances. And number two, any procurement has to go through the
office, the
procurement office, because that's the PFM Act.
Yes.
Okay. So what am I saying? If you understand the people you're working with, then you will face less challenges. If you try and come and bulldoze,
you tapata setbacks.
Hurdles. They'll just sabotage.
Another misconception I had also in West Pokot, my intern was bigger than me.
And then we were small.
It was big. So in fact, we had a very interesting conversation once. A patient, we went to see a patient together. I love teaching. So I wanted him we go through the case together. So I realized the patient's relatives are talking to him. Wanamwongelesha hivi.
Like huyu ndiye daktari, si huyu.
So my poor intern, he was called Dr. Biongo. He was a big guy, gentle heart, very nice guy, very keen on surgery, and he's still in West Pokot. So the patient's relative are talking to him. Then he keeps looking at me.
And like,
that must have been very awkward.
So my body's stature is small. And obviously my intern was a lot bigger. But you don't embarrass your juniors in front of patients. That's another thing. I can ask my senior colleagues never to do. Never talk down on your interns. Because those are the guys who are going to come and support you later. So after that, we had a good laugh. Hata nikanunua nyama. I told you, next time, fanya hivi. When they start angling like that, you just make a comment and say, hata mkubwa ako hapa. Go for 8 lots of farm. So that was another one. So moving that forward to private practice, outside this interview, you'll always see I'm wearing a hat.
Yes.
Always wear a hat. And it's very interesting because the background was I look like half my age. So
Also the hat is to make you look older.
no,
He has is it a Kongol? Inachangwa Kongol hat.
At
It is
least
to increase the age.
nikiandika invoice. Nikiandika invoice ya pesa fulani. Anasema
lazima hiyo ni yake
hiyo ni yake. Hajatumwa.
Oh my goodness.
So another misconception. and this is to members of the public, you might actually be dealing with a very senior, experienced surgeon,
Yes.
but he's very young.
Young, yes.
Nowadays, hizo enzi za
You have to have a kitambi
like this.
na mwili imejaa kwa kiti.
Karibu
Hakuna.
anakuja kama ametembea na bakora. No. Nowadays, very young.
Times have changed. Yeah.
And the young surgeons are technologically advanced.
That's
Okay?
true.
It's now I think nimeanza kuwa
Angalau,
kuna
Kidogo.
chafu hapa.
silver hair.
It's catching up. But anyway, the point I'm making is to the public, don't always think that the oldest one is the best.
Yeah.
Okay? So and also to the public, and I'm happy we're having this interview. You may find as your doctor has another life.
Yeah.
You know, like I'm sure we've seen DJs.
Yes.
We've seen all sorts of people
with
different
lives.
They have a life. Yeah.
So ukiona anakimbia na pikipiki, he doesn't mean he's reckless.
Yes.
He's
It's
just in
passion.
That's his passion.
Yeah.
It's his outing.
Yeah.
So don't judge
when you meet them
when
in
you
the
meet them
office.
in the office.
Yeah.
They will obviously take you as seriously as they take their passion.
That's true.
Yeah.
That's
So
true.
misconception ingine ndio hiyo.
I think there's another one that I've noticed. Like patients assume if I call my doctor, lazima it drops everything to attend to me. You know. So have you had that experience before? Like, hey, they expect you to be there on call all the time.
Yeah.
And how do you handle that? Yeah.
I think I've had it severally. My approach is a little bit different. Number one, provided we enter an agreement that I am taking care of you, and you have allowed me, and you have allowed me to take care of you.
Yeah.
You know, it's a bilateral consent.
True.
I give patients my number. Okay, and as I'm doing so, I also tell them, listen, I am available all the time, and if I don't pick, send me a message. I will call back. Okay. So that we don't enter that situation of
7 missed calls.
7 missed calls, you know, that kind of thing.
Yeah.
And also, I must say this: there is, as a surgeon, you want the patient to feel comfortable enough to reach out if there's a problem. There have been some cases in media that have resulted because the patient could not reach
the doctor,
and it would have been addressed very quickly before it escalated. Okay, so that's one end. And then also for members of the public, patients, tafadhali, you know, we are taking care of you. And many others.
And many,
not just you.
So have a bit of grace. Extend some grace. Hata mimi kuna wakati nimechoka.
Unataka tu kulala.
Ama I want to go and dance a little bit.
Yes.
You know?
No,
vacation.
You know?
Ati wakipatana club asiseme kitu.
Wakinipata kwa club.
Waachane tu na wewe sasa poni. This is my other life.
Lakini sasa sisi unajua hiyo umri ya club. Now we go to places.
We go to wazee, slow music.
Members clubs.
Oh, members.
Members clubs.
Okay. Sorry.
Sorry. And it's good. It's good to know that there's that other side. You know, you're allowed to be human.
And you're allowed. But I want to take you back kidogo tu. This is something that I feel like I need to ask. So ulikuwa Nikapenguria, si ndio?
Yes.
Alafu which is West Pokot.
Yes.
And then geography yangu si mbaya sana. Alafu ukakwa Muriranjas.
No, Muriranjas was before.
Was before. Okay.
Yeah.
So let me do this.
Yes.
To switch kidogo.
Yes.
Between Muriranjas and umetoka hapa, umekuja hapa. What would you say was the most commonest thing that they both have? And were the challenges a bit different?
Between Muriranjas and West Pokot?
Yes. Because they're both government.
Yeah.
But I'm sure ukitoka hapa na wende kwingine, kuna systems might be working a bit better here.
It has its own
unique
challenge.
Yeah.
Actually, very good. In fact, there's even another spanner in the works. Muriranjas was under national government. West Pokot was under county government. So in fact, the devolution
story comes in
you
now.
were there.
So in Muriranjas, we used to go to the to the DC. You used to go to the DC.
DC, yeah.
You present budget kwa DC.
Yes.
Wow.
Now at least county
unaweza
it has its own monster. But in my opinion, and I have said this severally, I think devolution of the health system was something very good for this country. All right?
It came with
but
blessings.
devolution has two main aspects. You have the infrastructural, medicine and supplies and those kind of things, and then you have the human resource. I'll tell you this, and sorry for going off the cuff a little bit. To devolve the human resource aspect of healthcare is where I have my problems. Buying equipment, building hospitals, that's counties do that very well. But the human resource, the nurses, the clinical officers, the doctors, the consultants, that, in my opinion, would have been best managed as a central, as a national resource. And I'll give you a very good example. When I was in West Pokot, I was the only surgeon in that hospital for 5 years. Actually, the 7 years that I was there. It's only the last year that Diongo came back. You know, I was the only general surgeon. All right. Next door in Kitale, there were 4.
Oh wow!
In fact, and they can't come from Kitale
to
you
come
to imagine, because in Kitale they are being paid by a different county.
Yes.
Do you get my point?
Yeah.
So for me, that's where like a health service commission or you know a whole commission would have been. And then it allows people who are leaving school to work further, and then they come as they settle down. So Moreranjas had its challenges, but also had its great opportunities, and have remunerated it. West Pokot, the main difference was the where the authority was coming from, and it makes a big difference because if you have a governor in a county that is keen on healthcare, then you'll thrive. If their priorities are elsewhere,
agriculture,
leadership sasa ndo important sasa.
So if you look at the WHO building blocks, leadership and governance, it's really up there. Of the 6. And then of course human resources.
Okay.
Amazing.
I think now tumejua.
Now I think under this space we also would like you to highlight a little bit of things that you'd wish patients or viewers to know, like from the surgical point of view. What are things that they should be wary about, what they should not miss out on, like red flags. For example, you're going in for a surgery or you've gone for a surgery, things to just be the key things you talk about.
Oh well, you have asked me to summarize a whole book in.
I know, I'm so sorry.
But I'll give it my best shot.
Yes.
For patients, I would say this, and I'm speaking from a general surgical perspective. If you have an ailment that has been with you for some time, don't wish it away. So for women, if you have a lump in the breast, you want to have that checked, just do your annuals. All right. For gentlemen, we have notorious health-seeking behavior.
They do.
So weight loss, passing blood in stool, those kind of things are things that you don't want to ignore. I also say it's important for us to talk about our problems.
It is safe.
Talk about your problems, because we are getting to a point where if you talk about it early, we can actually fix it. Than if we catch it late.
The chances are a bit slimmer.
Also, to establish a good rapport with your doctor will open up lots of opportunities to address your issues. If you're my patient, unanienjoy, unaniambia ukweli, unanizungusha hivi.
Anakuficha.
You know, so you wonder kwani sasa ni mtego.
I know that. I think sometimes what is it, people don't know how to answer. Like ukikuja unaulizwa, how are you feeling today? Default inakuwa niko sawa. And then now you have to probe and probe.
I think ni hatujafunzwa.
No, culturally.
Kuongea kukuja tu kusema.
Culturally, you're not supposed to say things about. It's African
It's
culture
African.
doesn't allow you to.
Unasema niko poa.
I'll give you a very good example. Another one.
Yeah.
So I do a lot of hernia laparoscopic hernia surgery. And that's the surgery where you operate, you put pots, so there are no scars. Basically. It's very small scars. And you can do big operations.
Sasa hiyo small ndio si scar. Si ni scar bado.
Ni kadogo hivi tu.
Kadogo sana.
Hebu compare
na zile.
Ni kweli the old school way of doing things.
Yeah, the old school. So patient atakuja aseme naumwa na hapa. So I actually had a patient like this. Naumwa na hapa. We talked about the hernia. And then he came back. We were almost in a relationship.
Yes.
I'm telling you about your problems. So we do the operation. It was very successful. Then he came back. Then one time he didn't come with his spouse or with his partner.
Yeah.
And he told me, Doc, tulifanya hii operation lakini pale ikwaje?
Kako sawa.
So I asked him, shida ilikuwa hapo mbeleni? He told me, So
that's how many months later. Yeah.
So now
you start looking
for a guy with a hernia problem, which he's been telling you is the problem. The guy has erectile dysfunction. Imagine if he had just said,
from the word go,
this is my problem. Yeah. A general surgeon will look for general surgeon problems.
Yeah.
I would have sent him to the right urologist
and get it sorted.
Okay. Yeah. So patients need
to be open.
We fixed our problem, but
there was another one.
Yeah.
There was the main one, actually.
Yeah.
But I think it's something that I've also seen in medicine. Like, I'll even give an example. I have an uncle, and sorry to say this out, hadharani. So, ninachoma picha wacha tu. He comes, he gets chest pain. Na anasema tu, wewe nilala vibaya jana. Stays almost a week. Then it reached a point he can't even take a step. And then now, the wife anashinda kimuza, are you okay? Anasema, sikulala tu vizuri niko sawa. Goes to the nearest clinic, anaulizwa, are you okay? Ati, nipe tu antacid. Painkiller. Doesn't want to talk. Until now, he couldn't move one step. Then he was like, sasa, kuna shida mahali. And you know, the guy came, he has been having MI for all that time. Comes, drops at Aga Khan, then brought to here. Guy has 4 stents. Then baadaye anakuja kutuambia, baadaye mimi ningekuwa nilienda. Ambe ulicheza na Mungu lakini unapendwa. So unapendwa.
Very close.
Yeah, so these things, even women in the village, we still see the same thing. Like we talk when we go for functions, we find them not talking. Alafu anakuja na kuita kando. Anakwambia unajua Cherotich nilikuwa sisikii vizuri hapa. Inaweza kuwa ni nini? And I'm like, so ulikuwa na daktari ukusema ati niliogopa tu.
Maybe it's just to tell people that it's a safe space. I don't know if patients realize that. But how do you even
start that conversation?
No, but can I tell you what has worked for me? When my patients come into the clinic, you don't start with unaumia wapi.
Unaanza story.
Una break ice. This I was taught by my mentor. Kwanza tena if I can see umekuja na kamutu na kamutu ana inspect vile unaongelea patients. If you don't want someone to know, don't come with them.
Yes.
Unaana always asking for permission.
Yeah, looks and then answers. Looks.
In fact, sometimes you don't have
yes.
So what you do, what I do is I just break the ice, ask how's your weekend, and then as you're talking about this, the problem
now just crops
it will
up.
crop up.
Yeah.
Then you talk about it, and then even as you're finishing, you also finish with
the solution.
With the solution and some words of
encouragement.
Because half the patients who walk through that door,
they're scared.
Wanataka tu kuambiwa, by the way, it will be okay.
Iko sawa, utakuwa sawa.
Tutatengeneza. That time inside as a surgeon, you're like,
God, that's a tough.
I don't even know.
Umejiingisha wapi hapa?
You don't even know where you're going to, utafichia. Because you just say, okay, now this one, I have to do this, this, and then you're looking at her or him and you're like, by the way,
but you'll be fine.
Let's do this. Especially like terminal cases. It becomes very difficult. You have to show words of encouragement
and empathy.
You have to empathize. But a lot of my colleagues also understand that technique, but they just probably address it or approach it in a different
way.
So for me, I
you
try
to na story.
Mi naanza na story. Kwanza nijue what is the real reason you're in this office?
Like, why are you here?
Unapima.
For them actually psychological,
mental. Then someone breaks, you're like, oh, okay. But it's a good strategy. But how do you balance between empathy and giving now good patient advice? Kuna venye una crossing kidogo.
Actually, it's one and the same thing.
It's one and the same.
Yes, you can empathize with someone's situation. But don't sympathize.
Don't sympathize, but empathize.
If you're a doctor and you're already saying, oh yeah,
that's really bad.
I'm going to church. Sasa, she has come for your help. Oh yeah. Don't sympathize. We are in this situation.
We will help.
We will need to do this, that, and that. We will reach a conclusion, and I will walk with you throughout.
Or just your encouragement, your true firmness.
And then they'll be like, with you.
Faith.
You'll be okay. And even if a challenge comes,
tutapita pamoja.
Kupona inaanza
hata ashapona atakwambia tu daktari asisikii kitu sasa wacha niende. But it's good.
That's an approach.
Okay. I like that a lot. So many challenges, but I think for every challenge there's always a solution and something to learn and pick from it.
Absolutely.
Kuna misconception hatu kusema tulikuwa tunaongelea tu kando ya treatment in these rural places.
Oh yes.
We had wound care.
I don't know if viewers you've ever had this, like as in Ushago, wasa wakipatanga a wound and a deep cut or something, used to take mchanga and pack wound. That's packing to stop the bleeding. And pona. I don't know. Have you seen crazy things people have done in such scenarios?
At least yako ilikuwa mchanga. Mimi nimeona kauda.
My goodness. Please don't do this, guys. Don't do this.
So it's a lady. She had breast cancer. She was told that hiyo kidonda itapona. She was put for cow dung like this.
Oh no.
Wanangoja kidonda ikauke. Do you know when she came to the clinic? She had sepsis and the hole had gone all the way to the chest.
No.
So now you're trying to tell. Do you know why they came to the hospital?
Yeah.
Walikuja kwa hospitali ndio hiyo ioshwe.
Ndio
warudishe. No.
So misconceptions are there.
Yeah.
Please
do not.
Now imagine, now as the surgeon, I was being given directions. Daktari, mimi
nataka utoe
hii uchafu. Unaona pale iko black. Nataka utoe hivi, lakini usitoe yote. Hiyo ni yetu. Tutaendelea kuweka
ndo
ipone. That lady, that girl, she was 34. She had metastasis to the spine.
She has
sepsis. To the liver. She had sepsis. And now she has a big wound in fact,
in the chest.
I'm sure she had also mets to the brain, but we didn't have
to scan.
Okay,
so
that's
please,
a big one.
Let's I'm not.
Go to
Just go to a hospital. Seek some conventional advice. Conventional medicine.
Okay.
I'm not downplaying herbal medicine.
Herbal medicine, yeah.
I'm not a specialist in herbal medicine either.
Yeah.
But where I'm standing from,
Yeah.
at least I know this one is good for you.
And this one is bad.
This one
good.
I don't know.
I don't know.
I don't know.
That's bad. You don't know.
It's time you comment.
Yeah.
Well, I know in Calais we have that. Like we like especially if you have pain on your muscles, na haujapata, like you've taken painkillers, it has not worked. I know we usually cut and then now we put
like
so
incisions and
incisions,
then
and then now there's a leaf inawekwa kwa moto, inafinywa inakuwa powder, then you wake and it actually works. So
iko na paracetamol.
Yes, ile iko na hiyo iko hapo ndani. And even with babies we do that, like we give them it's called Pusareg or something. I can't remember. My colleague is very poor, but we at 6 months to avoid teething problems. We just paka kakijivu inside.
There's the one thing I saw that actually shocked me. In West Pokot, there is I thought I was seeing my own things. There is honey. There's honey that's harvested from underground.
Yeah, the black ants.
It's black.
Yes.
It's black. It's black honey.
Yeah.
And then that honey doesn't crystallize. You know that thing doesn't, and then it tastes it's sweet, but it has an earthy.
Yeah, it tastes like mchanga.
That honey, kama kuna mtu akona pesa, go and research that honey.
There's healing properties.
There is I saw it used for a baby with oral thrush.
Yeah.
And it cleared.
It clears.
Yes, it cleared. In fact, nikaitisha wale
liter
Nikaenda I went home with it. And then I put it in the house and I told my kids,
Hii
si ya mkate. Ni dawa. So I agree with you. There are properties
that actually work.
That actually work, and just that we don't understand them doesn't mean they're bad.
True. Yeah. You know, it's always good to go with caution, I think.
Or ukiona imeshindikana, wachana tu, seek medical advice.
Seek medical advice.
And by the way,
hospitali.
Just go to the hospital. Tafuta, lakini unajua even as medics unashinda wengine kama ni madaktari. They give some advice just because they're wearing a white coat.
Yes. Also don't be cautious. Another misconception there.
Another misconception. Everyone in a white coat is a doctor.
Not necessarily.
Ulizia kwa makini.
Yes.
Kweli. All right, this has been very interesting, insightful, and eye-opening.
Yeah.
So thank you, viewers. I hope you've enjoyed this episode. And as we wind down, we want to remind you to like, subscribe, and hit that YouTube button, knowing your medical maestros beyond the white coat. Follow us on our socials, and we'll put a link even for Doc. When you're mnataka to find out more, we'll put a link for Doc there.
The link is on Instagram, Blade Doc.
Blade Doc.
Yeah, and you can check. You can catch our. You can look through the website what we do. bladedoc.net. Just look through it and see the amazing things that we are doing.
Awesome. Until next time, it's goodbye from us. Bye.